Grim reality. 2 people per hour are dying from the coronavirus in our state. 48 deaths in the last 24 hours, the highest single-day total since May. The positivity rate is also steadily climbing. Hello, I'm Denise Koch.
And I'm Vic Carter. We just learned that one of the recent deaths was a longtime employee of the Baltimore Department of Public Works.
Now, with a vaccine on the horizon, Governor Hogan is urging Marylanders to stay vigilant until it arrives.
WJZ is live. Avadra Burnett explains that even if it arrives in the next few weeks, most people will have to wait until spring to get it. Ava Joy.
Well, Maryland saw one of its worst days in the coronavirus pandemic in months, and the governor talked about this earlier today on national TV. He also addressed the fact that even if you are a frontline healthcare worker, you may not be able to get the vaccine right away.
Sticking with the recommendations from the CDC, Governor Larry Hogan said when a COVID-19 vaccine is finally approved, certain essential healthcare workers will be the first to get it.
So we have about 300,000 of those. So our plan, which we submitted to the CDC, prioritizes the most vulnerable. So our frontline healthcare workers, our nursing homes, and then first responders. And as they come in, we just start working our way down that pyramid of a list.
Plans to distribute a vaccine comes as the virus continues to spread in the state. 48 people died in Maryland in the last 24 hours, the most deaths in months. In today's data, hospitalizations dropped slightly, but the number of people in the ICU is at the highest level since June, and the state's positivity rate is well over 7%. The initial delivery of the COVID-19 vaccine could come in mid-December after FDA approval. But Governor Hogan said that will not be enough for the 300,000 frontline healthcare workers in the state. He, along with many healthcare officials, are reminding people to stay vigilant because the vaccine may not be widely available for months.
Sadly, this is the darkest days are yet ahead, and hearing the statistics you were just talking about earlier, the worst part of this virus is still coming in the weeks and maybe the month or two to come.
And once a vaccine is widely available, healthcare officials are desperately trying to reassure people that they will be safe. We're going to have that angle of the story coming up on WJZ at 5. Live at 4, Ava Joy Burnett for WJZ.